Good morning. I'm Dr. Deukmedjian, CEO and founder of Deuk Spine Institute. Here in Florida, our patient travels here from the Dominican Republic. He has a 3-year history of neck pain at the C5-C6 area on his neck. We've just completed a facet joint treatment with the Deuk plasma rhizotomy, a permanent rhizotomy destroying pain nerves in the back of the neck, innervating the facet joint. Now we'll be addressing a herniated disc. Who was it? Oh. He has a herniated disc at C5-C6. His neck looks remarkably good, but he had an injury. He felt the pop. He has an annular tear and disc herniation. We're going to be using a laser and an endoscope, 4mm incision with an outpatient surgery to treat the herniated disc, basically remove the herniation and clean his tear. This is a procedure we've been performing for 20 years here at Deuk Spine Institute. It is an advanced form of laser spine surgery. If you have questions, feel free to type them up. I'll answer them. What's the problem? All right, let's get an x-ray. So I'm going to place a needle first. Our patient's asleep, intubated shot. 2, 3, 4, 5, 6. Everyone agrees that's 5, 6, yes? All right, then let's get an AP. Why don't you show our audience the 30 different causes of neck pain while I'm placing this needle. Shot. I'm Dr. Deukmedjian, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. All right, you've all seen the 30 different causes of the neck pain. The vast majority of neck pain comes from disc injuries like this patient has at C5-6, the most common disc to get injured and cause neck pain. C5-6 is the #1 reason people have neck pain. Look at this incision, 4 millimeters, folks, 4 millimeters, 4 millimeters. It's on the front of his neck on the left side. I placed the guide wire. Shot. I'm using my lateral x-ray to remove the needle. Keep the guide wire in place. Shot. Perfect. You can see the herniation on that view. Show the herniation on that x-ray. Go to the x-ray view, please. Go to the x-ray view, guys. You see that herniation right there, the dark pointy? That is the herniation at C5-6. Shot. You can stay on the x-ray view if you'd like. We're basically placing our dilator down to the front of the spine. The dilator tip is at the front of the C5-6 disc. AP. I'm going to verify we're still in the middle. You want to make sure the tip of your dilator enters the anterior longitudinal ligament, which is between the two longest colli muscles, and it is. We are about 5 millimeters off of the midline on the left side, which is fine. The anterior longitudinal ligament is approximately 2 centimeters between the left and right longest colli muscle. Shot? So you want to be between the longest colli muscles. You don't want to go through the longest colli muscles. If you go through the longest colli, you can injure the sympathetic trunk. Patient will get a Horner syndrome. All right, we're almost there. Shot. I am now at the back of the disc at C5-C6. Let's count discs for the benefit of the audience. You see the white arrow on the X-ray? That's number 2. I don't know what you're pointing at, Jordan. Go up to 2. Yep, 2, 3, 4, 5, 6. So we are at the C5-C6. I'm placing a tube over the dilator. This tube is what I will do the entire surgery through. Remember, we made a 4 millimeter incision. You guys see this here? The tube is 4 millimeters wide. So we made a skin incision just wide enough for that tube. Thank you, Luis. You see that? Use the camera overhead. All right, I have no idea if you guys are seeing this or not. Shot? Any questions from our audience?
No questions at this time.
Thanks. In that case, let's show the audience the video on how do disc injuries cause neck pain.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You can see from our video how herniated discs cause pain through inflammation in the back of the disc and how we repair that damaged disc with a laser and an endoscope. The important thing to understand is Deuk Spine Institute has been performing this surgery for 20 years now. We were the first in the world to identify the annular tear as the source of neck pain and back pain. The first. I was the first in the world to identify that. And I was the first in the world to pioneer a treatment to go in and clean that tear, remove the inflammation, remove the herniation, remove the scar tissue, remove the calcified annulus, and basically clean up the area, getting rid of all that inflammation and what was causing the inflammation. That's what we've got right here. You see this white stuff and the gold stuff? The white is scar tissue, the gold is calcification. That right there, my friends, the bone is the end plate at C6, the superior end plate. And here is the laser fiber at 12 o'clock. There's a piece of herniation right there that I'm removing with the laser. Any questions?
No questions at this time.
I'll go back and forth, left and right, to get the whole herniation out at the back of the disc. Once again, this is the C5-C6 disc herniation. This is what's causing his neck pain. When we're done here, he's going to feel a lot better because we fixed the facet pain already with an earlier procedure called the Deuk plasma rhizotomy, and now we're removing, that's a herniation right there. Now, that herniation barely fits in the tube, right? The tube is 3 millimeters wide. So think about that. That piece of herniation is about 3 millimeters wide. That's very small, right? That's not a big herniation. But it's significant. It's causing inflammation. It's staining blue, and I'm sucking it out of the top of the tube, so it's gone. We're coming back with the laser. We're going to remove some more herniations. Here's another piece of herniation right there. Any questions from our audience?
Not at this time.
Oh, big herniation right there. All right, I'm going to go in there with the grabber, turn the light on, come to the camera, bring your switch over to the camera from the X-ray. I'm going to try to pull this thing out and show you guys. Right here, piece of herniation. Again, small. There's no big pieces of herniation in the neck, it's just all small ones. But they add up like marbles in a marble sack. One marble is not going to do much. But when you fill the sack with 50 marbles, now you got a big thick sack full of marbles, right? That's really what herniations, that's how they work. They don't do much by themselves as an individual herniation. It's really the cumulative effect of many pieces of herniation in the back of your disc over years. Every time you lift something, once you have an annular tear, you get more herniation. And that lifting and sometimes sports activities pushes out more herniation, which then causes more symptoms for the patient. Any questions?
No questions.
Are you streaming?
Yes, we are.
All right. Typically we have questions by now. You're sure you're streaming on all the platforms? LinkedIn, X, Facebook, YouTube. Have you verified the stream is live on those using another
Absolutely,
computer?
yes.
You have. All right, good. All right, well.
I just checked it on my Facebook. We got it.
All right, good. I guess we've done such a good job of educating the public, they don't have any questions, so I like that. All right, we are going into the foramen here. You can see the uncinate process starting to form right here on your left of the laser fiber. By the way, for reference, that laser fiber is half of a millimeter, 0.45 millimeters. So basically just under half a millimeter. That's a bone spur right there. You see that golden color stuff I'm hitting with the laser right now? That's a bone spur. I am literally removing that bone spur at about 1/10 of a millimeter at a time. That bone spur is digging into the nerve here on this right side. You got scar tissue right here from the inflammation. You've got calcification that's coming from chronic inflammation due to the herniation. By the way, you're watching the most advanced spine surgery in the world for treating a herniated disc in the neck. Unfortunately, most other doctors are not trained to do this kind of surgery. In the United States of America, there's only me that I'm aware of that does this surgery. I learned this endoscopic technique from the South Koreans, from Dr. Seng-Ho Lee about 20 years ago, and I've been performing this surgery for the last 20 years. Most neurosurgeons are still doing fusions, artificial discs, which are highly invasive, dangerous, and completely unnecessary. You're only going to find this Deuk laser disc repair here at Deuk Spine right now until I train more surgeons, which is certainly going to happen in the future. Any questions?
We have one comment and one question.
All right. We'll
First,
take it.
okay, well, we have a comment
5
from...
minutes. 5 minutes. Go ahead.
We have a comment from Sammy Kamel on YouTube.
Hi, Sammy.
Says, great job.
Oh, thank you, Sammy. Means a lot to me. I appreciate your positive vibes, as the Democrats love to say, positive vibes. I like positive vibes. Okay. Thank you, Sammy. We have a question.
We have a question from Charles Sutker on YouTube.
Hello, Charles. Sucker.
Could
I
you
like
please
that.
comment on radiologist? I had an MRI study and had 3 radiological rates. Similar but different.
Well, slow down.
Okay.
Oh, okay. I hear what you're saying. So this person had an MRI and got 3 different reads.
Yes, 3 different rates.
Rates or reads?
Rates, costs.
Costs. For what? For getting an MRI?
Yes.
Oh. So he wants me to talk about the cost of an MRI.
Yes.
I see. Well, the cost is really dependent on the MRI center. Everybody has different costs. It's going to vary depending on how old the MRI is. If you have a newer MRI, a better MRI, you're probably going to end up, paying more for the MRI scan. But I think we charge something like $600, and if you're paying cash out of pocket, we take about $300 here at Deuk Spine. I think that's some of the cheapest MRI you're ever going to find for the spine. I know that there are other MRI centers that charge $1,000. Some of them charge like $6,000. I think that's excessive and unnecessary. I think, we lose money on our MRI, that's for sure, but we don't really have an MRI to make money. We have an MRI to help people figure out what's wrong so they can get it fixed. So our philosophy is a little different. We don't see an MRI as a way to make money. We see it as a way to help people diagnose what's wrong and then come up with a treatment plan. So our philosophy is different. Everybody is different. All right, we're done. I think we've gotten all the herniation out. This is the last piece I can find. He did not have a lot. He probably had about 15. So he's a young guy, and this has really been bothering him a lot. But now we've cleaned out the herniation, and I think he's going to do fantastic. You can see the posterior longitudinal ligament there. It's pretty much intact. I got rid of all the herniation. There's some scar tissue that I got rid of and bone spurs. We're done. Any other questions?
Charles actually wanted to correct himself. He did meant to write reads, not rates.
Oh, reads, yeah. So Charles, you bring up a great point. If you take your MRI to 10 radiologists or 10 doctors, you will literally get 10 different reads. I'm not joking. And that's because they're all looking for different things, okay? But none of them know what to really look for that causes pain. And that's what we need, sort of a complete change in this world on how radiologists interpret medical imaging. Because this patient right here, he has literally a tiny bulge on the MRI, tiny. And a lot of radiologists would just say normal disc. But it's not normal, and it's definitely the cause of his symptoms. So it's important that radiologists don't underread studies, that they call the bulges and herniations when they're there. But I can't fix and standardize the reads. Now maybe AI will someday, but you got to worry about that, because if AI is doing all your MRI reads, it could be paid by the insurance companies to not read herniations. In other words, if the AI is doing the reading of your imaging, and United Healthcare, for example, says, hey, AI, just ignore those herniations, pretend they're not there. If they're small, then the AI will ignore the herniations. And of course, it's whoever controls the money controls what happens, right? So United Healthcare would basically, or some health insurance company or some auto insurance company would basically make those studies be underread. Therefore, you don't get a diagnosis and you don't know what's wrong. And you end up having to live in pain the rest of your life, but the insurance company saves $100,000 not paying for your surgery. So you got to be very careful, very, very careful. And I see that today with radiologists. Okay, so if you, for example, hurt your neck in a car accident and you call a lawyer who's going to help you with that car accident and try to sue the insurance, that lawyer is going to send you to get an MRI from a radiologist that will read the MRI and say, oh yeah, there's herniations everywhere. That way they can try to get the most money from the insurance company for you. On the other hand, if you do work comp, you injure your neck at work, and the work comp carrier insurance is going to send you to a radiologist who's going to say there's nothing wrong with your MRI. And I've seen this happen in real life. It happens every single day, all the time. And if the radiologist that does the work comp read says there's problems on your MRI, then the insurance company won't send any more patients to that radiologist. They lose business. So they get punished for telling the truth. This happens all the time. People don't know about it. But I've seen it for the last 25 years in my practice. Okay, Here's the incision, 4 millimeters. It looks like a vampire with a broken tooth bit his neck, and he's going to go home in an hour. This is replacing spinal fusion and artificial disc. ACDF no longer needed for this kind of problem. Just come in and get the laser done. 99% success at curing pain, and it's outpatient. No hospital, no metal, no hoarseness, no trouble swallowing. I mean, it's an amazing procedure. 0 complications in the operating room for the last 20 years with this procedure. All right, thanks for joining us. We'll be back shortly with a sacroiliac joint Deuk plasma rhizotomy. Basically a patient who has sacroiliac joint pain, and we're going to fix it by going in and destroying the pain nerves causing her pain from the SI joint.